Welcome back to You Skilled Home Podcast, the show where we explore the world of health and wellness, providing valuable insights and practical tips for a better life. I am your host, Yani, and I am joined today, of course, by Greg. We will talk about back pain issues today because so many of us get affected by it, causing discomfort and disruption in our daily lives. In this episode, we were tackling the topic head on, addressing common misconceptions, sharing prevention strategies, and providing actionable advice for finding relief and fostering a healthy back. Greg will be answering all our questions. He'll be able to give us advices on his own perspective. And so whether you're seeking solutions for persistent back pain or looking to prevent future problems, so this episode is for you. So before we begin, remember to subscribe to our podcast, which is Useful Home Podcast. We are in YouTube and as well in Spotify, so that you'll be updated on our future episodes filled with valuable insights. And be sure to follow us on our social media for community engagement and to connect with others for to see their wellness journey. So let's dive deep and let's start with our first question. So can you give us a brief overview of the common causes of back pain?
Yeah, definitely. There is common causes start with bad posture, weak musculature weak core, which we say weak musculature in the front side of the body and the back side of the body, flat feet, hips disbalance, lifestyle mistakes. So this is just common. We are not talking about medical diseases. We're just talking about healthy people who have not healthy lifestyle, but they don't have any problem in terms of medical.
How prevalent is back pain today, and why is it so important to address it?
I would say mostly people after 20 already start to experience here or there back pain. Very less people we knew, and we see in our students. People, they do have 99% of them has some issues. Or have currently 99%, maybe 1% who didn't have any back issues.
And how important, why it is so important to address it right away? Whenever, you feel probably a first trigger of back pain.
All right. So as we said, after 20, everybody start to have certain, let's say, degeneration start to happen in your back. What does it mean? It means between your vertebrae, the disc starts slowly deteriorate over time. For somebody
from the 20th,
due to the straight posture, yeah. So there is wear and tear start to happen in micro dosage, but still, right? Everybody has different genetics. Those who has more thicker backbones, they can handle longer, right? They might experience less back pain, but not all of people like that. Most of the people have very normal spine and start to get after 20 due to posture, lifestyle, and everything back pain. Just normal aging, let's call it. So definitely, sooner or later, you need to either prevent, either deal with it, and build musculature around it. What I'm trying to say, if we check MRI of every one of us now, 100%, we will have some disc bulge, we'll have some protrusions, which means the already discs start to melt slowly. We'll have here or there some degenerative processes. So it will be in each and every back. As I say, maybe 10% or 1% will be just unique. So we cannot do nothing about it. But what we can do, we can build the musculature and improve our lifestyle so the back can be a reliable unit of us.
But it depends also. Okay, you're talking about spine, but how about, when I always have back issue on my right side, is it connected to the spine and all, like all these muscles. I don't know. Lower back pain.
Exactly. There are
so there are different types.
different clans of specialists. Some specialists saying that it's all interconnected in the body, from your hips to your shoulders to your knees. However, I was also one of the followers of those type of ideas. So if you have the issue with the right shoulder, maybe it's because of the shortening of the left hip, and but recently I start to think that you need to address things locally, which means if you have issue with the right shoulder, probably there is something wrong with with scapular movement, some muscle getting shortened all the time. I don't think so. It's that much interconnected with your hips and glutes adjustment at this moment. But of course, I'm studying daily and see different opinions. I might change it. But for now, I would work on your right shoulder separately without thinking that it's coming from the left hamstring or whatsoever.
I understand. So, understanding more about back pain, like what are the misconceptions, most common misconceptions about it?
I think people start to take pain relievers immediately when they have back pain. They start to put creams. However, there is if it's already inflammation there, why you putting cream? What you trying to heal? So it's already the symptom, right? So you need to cure the cause, and then you need to know how this causes happened. So I think this is the misconception. People try right away to cure the symptom, and symptom it's already a result of.
And some
something.
of them they might do massage right away, or
Yeah, exactly. Massage is temporary relief. Like again, let's imagine the person is walking not correct, or he has some hip disbalance and everything. So muscle will be always shortened or long. Depends of the posture. And he goes to massage. He has pain relief. I agree. For the same day at massage done, and another 2-3 days. After 3 days again, same it will happen, right?
Yeah.
So, if muscle keep triggering, instead of thinking why it's keep triggering, what is the reason? There's two options which comes in my mind. Whether it's, so imagine you have back, right? You have core around and everything. And let's call it resource. So you didn't build enough resource, you didn't build enough musculature to hold and protect your back, or you overusing it due to your, I don't know, for example, people from agriculture work, from farming, they used to have lots of back pain. So it's a misconception saying people who in the farmers and agriculture, they're very strong. No, they suffer a lot from the back because they've been bended over all the time due to their work type. So
I think even the masseurs.
Of course, masseur, dentist, cosmetic, whoever you name
nail
it.
Specialists and all
specialists, exactly. Barbers, accountants, IT, whoever you name it. Everybody, due to, for example, dentist, if he's doing operation, being hinged for hours, definitely he has the back issues. And imagine, it's not just directly tilted, it's tilted with small rotation, right? And for a time, exactly. So now imagine that couple of muscles just keep holding all the structure. If this muscle not strong enough, they lose resources, so back start to take over. And that's where over time, not immediately, everything is compounding in the pain. Nothing happened immediately. If you think that disc, bulge, believe me, it's a result of multiple mistake over time, then it will happen like that.
Understand. How can individual then differentiate between normal back discomfort and a serious issue that requires medical attention?
I believe serious issue, it's when the pain is not stopping. I think this is pretty serious. Normal back pain, you walk, right? And you feel the back pain in the movement, or you sit, you feel in the seat. But as soon as you lay down, you find, you can find here and there a position where you're okay. So most probably it's some muscle spasm, strain, or similar type of issues.
It doesn't stay for a long period of time. It just comes and go. Depends on the activity.
Under certain positions.
Yeah,
right.
under a certain position, under a certain activity. For example, if you bend over, this is causing me back pain.
Exactly.
Okay, when I sit down, causing me back pain. So
sure.
If it's like that, then...
Exactly, but if it's burning, if it like literally burning, if it's in any way it like muscle always contracted, if it's radiating, means it's coming to the leg, coming to the middle side of the back, to the thoracic spine. So
Yeah.
it's definitely a more serious case. I don't think so. It's you need to treat it with massage or something else. And again, usually for the pain, give like 2 to 3 days. Let's see, like within 3 days, the muscle pain should be a little bit eliminating by itself, right? But if it's not happening within 3 to 1 week to 2 weeks, yeah, definitely it's
Something else already.
something else,
Yeah,
yeah.
that needs medical attention. Like, okay, let's go back more. What is, I mean, like there are different types of back pain. There are lower back
Yes.
pain. There are, I think, a lot. So can you name all of the types of back pain that people most common back pains that people suffer?
I cannot name all of them. I just name
Just
it
the
what
most common.
what I'm facing with. Definitely, people used to hold their lower back exactly where is the back extensors, this lower back muscle. They keep holding it, obviously, due to it's weak or any other case. It also can be lower down. Yeah, if we move to the hips area, when they near the tailbone.
Tailbone, yeah.
It's another issue. Very often it's already nothing to do with lower back, but it's to do with musculature, which is around hips, right? So, if we would need to recover and rehab, we would work around this. And there is something, of course, already chronic diseases. Like I do have a students which I could not help. Like it's already chronic. Like, okay, in my mind, okay, through the musculature, I can try to hold the structure, but it's like already deterioration for so long. So either some medical intervention should be done or some compression all the time. But at the same time, I still believe if those students would put a little bit more time, more efforts, and more like dedicated prehab work, I think even those cases could be cured. I know, I do understand. It's very boring, very annoying to recover because you need to, for example, hold some position for a long time. You need to recover. You need to do hundreds of repetition of, small muscle groups. So not everybody willing to do that. Yeah.
I think also all these, right and left shoulder is part of like back pain issue, right? Like, at the back, all of these.
Because when you talk about back, I'm still thinking about lower back.
Lower
mostly.
back. No, like the full on back. Like this includes, right? All of these, what you will feel here.
I would call it shoulder pain. Because again, back, like this, what you experience, it's already upper back, right? But you feel the pain around the shoulder blades. Yeah.
So this is not...
No, we can call it back, but I think we need to address within shoulder blades area. So why it's not sliding properly, why it's keep triggering, why you have restricted movement, why the bone of the arm is not properly moving in there's in the clavicle bone and the scapula. So probably there is a problem. We're not physiotherapists, but through the practical experience, we just know something is there.
Correct. And are there any specific risk factors that make someone more prone to experiencing back pain?
Yeah, I think those who experience any, for example, operations on the knees and everything, they start to, we have the cases people who did already operations like ACL or whatever, they subconsciously a little bit slouch, right, on the side. So definitely the back start also little shift. In the long term, it will be a back pain. However, also, we know the other case scenario. We start to train, build up musculature, and it's fine. It's holding the back, holding the knee. But as soon as muscle tonus is falling down, again, back pain appears. So these type of things, as I say, heels, the flat feet, sometimes the feet very pronated, means like inverted inside. So also the hips are shifting, so also the back is getting misaligned, hips issues. Also, you've seen some students who has
Yeah.
hip disbalances. Like, yeah, so person always keep putting more weight on the right hip, left is just, as a trailing leg. So of course, over time, hyperlordosis, when they, arch the back a lot. So another case, and so like, so on.
So, what are some effective strategies for preventing back pain from occurring in the first place? Like, let's say, okay, you're on your 20th and 20s, and what are any effective strategies you can do just not to experience back pain, or not to have such back pain?
Obviously, we need to look at the lifestyle. Yeah, because even with the proper training, if it's not proper lifestyle, people can work sitting on the sofa, being bended over, the posture, the lifestyle, how they even consume food. Some of them sitting, in the completely tilted way. Look at the look at the shoes. What type of heel they do have? What type of soles in the shoes? Is it classic shoes, sport shoes? How they walk, right? Look at the gait. Gait means how they walk, right? Are they slamming legs down, or there is nice and soft posture? Are they, legs coming inwards or outwards? Also, it affects. Look how the legs are moving. Are they shuffling, or they properly put step by step feet? These type of things. Look how their head posture now. Now, they through computer, you drop the head down and everything. All of us guilty about it. And people do it also for hours. Obviously, it leads
8,
to
12, 9 hours.
exactly, just on the phone or something. So
Phone as well.
exactly, you can name it. And the main things, doing this type of boring work as a back extensions, as the side planks and planks and sit-ups and everything on the daily basis, it's not sexy as you can say.
Yeah.
But this type of thing is actually can prevent so many accidental, because accidental stuff happening, right? You pick up something through the side, you lean somewhere,
Yeah.
and it's happening, or you just twist it and pick up from the floor, and that's where the back's usually getting snapped or anything. But again, it happens in mostly with unprepared, or the back which has already some issues.
Since you mentioned already some exercises, can you name, let's say, most common exercise or stretches that can help strengthen the back and reduce risk of pain?
Yeah, I would address it personally, because not everyone.
It depends on each.
It depends. Like, for example, we do
But
have.
most common that can, like the general public can do.
I would believe.
The most easiest and safe exercise or stretches that will help reduce the pain.
I think planks can sort out lots of things. Yeah, just normal straight plank, side plank, the Superman holds. If you do it for a time, like if you do it with additional weight later, if you do single elbow, there is lots of variation to make it stronger. If you're just doing that, you already can, again, build it up over time. It's like called isometric training, which means the body is not moving. You just stay in stationary. Just you find the position under which the body is experience the load. So I believe this is minimum to build up the core.
I thought that planks would focus a lot in core, but also it helps the back.
Core, it is back. Core doesn't mean abs. Core, it's so much group of muscle, including the lats, including the glutes, including, like, let's call it trunk. Core, like the core is trunk. Like you from the chest almost till the hips, yeah, all around.
Including this.
Yes.
That's core.
Exactly.
Wow. Never see
Yeah.
Never imagine it like that.
Like imagine core, it's circle around you. So that's
This is your core.
Yes.
Interesting. Okay. How does one lifestyle, such as physical activity levels and sedentary behavior, contribute to back pain?
So sedentary lifestyle, how it's make it worse?
Yeah. Contribute, yes.
We can say, see, the main thing, okay, if we talk in this way, as a human being, we bunch of like bags with water, right? With fluids, it's blood, it's plasma, you name it. It's different type of liquids which we carry on. And they're supposed to move ideally. And they are moving actually. During walk, during movement, they've been more active, right? So which means muscle work and muscle, there is nutrients coming into the muscle, throwing nutrients to the spine itself, right? Spine also feeds the discs between, right? It's also, it's like osmosis process. So like there is always diffusion. Yeah, there is liquids coming inside, outside. So that's why when we wake up, we're a little bit, right? Taller, by down we go a little bit shorter. So because it's all about liquids. So when we sit, we reduce, like for a long time, there is not proper the fluid movement. So that's why, of course, it's ideally you need to, every 45 minutes to an hour, you need to stand up, walk around, if you can stretch. So that's the thing. So even there is a saying, one of the best treatment against back pain, it's walking. Yeah, I mean, if it's not pain that you cannot walk, but if you can walk, due to walk, you know, the cadence of the feet, it's improving the liquid exchange in your body. That's it. That's why, just think in this way, okay, why it's important to strengthen the muscle and everything, not just to build up additional staples around the back, right? Like additional staples around the back with a core, like just, you know, like you build the house, right? You just put additional pillars.
Yeah.
So that's why we are building muscle. But also, when muscle are working, they absorb, you know, as a sponge, they absorb the water, nutrients, vitamins, everything else, and also through diffusion they feed the back. And this is how it's supposed to be. So because nothing comes directly to the spine to feed it, it's come through the muscle feeds the bones like this.
Understand. How about any dietary factors that can influence back pain, such as an inflammation or weight management? Are there any?
Obviously, overweight people have back pain as a priority. Like they get back pain even from walking, and also if they have excessive abdominal size, you know, it's pushing them forward, cause to arch the back always being like the lower part of the back always being shortened because they need to hold this big belly in front and like it's causing back pain. And you know, it can cause even from walking, from small movements, and you just keep guessing why it's happening. Like you need to put some protection against it, but in fact this person overweight, and that's how reality is.
No, I mean any dietary factors like food
wise, honestly, what you say, the inflammation, like lots of food which cause inflammation. Yeah, so that's why I believe, but I cannot say that food itself will be big reason of that. Just the thing is, when you get into trouble, then you need to remove food which cause inflammation. Like I need to double check what it was. If I'm not mistaken, spicy food and everything. So you need to have more antioxidant food to reduce it. But it's different topic. About food, we will better talk it separately. But I don't think so. It's a major factor. Major factor is if it's not disease, it's something with muscle
and lifestyle. Okay, so of course, a lot of us are working, right? So this question is so important to cover. Like, what are the common mistakes people make in their work environments that contribute to back pain? We know sitting, posture, sitting long hours, you know, head down, like the position of your computer is too low. not in your eye level, probably all this, right? And anything you can add.
No, this is main, of course. I believe, at least what I seen here, especially in Dubai, and again, let's come back in the work environment or lifestyle environment. It's whenever I see the people, I keep checking their ankles always. So based on the ankles, we will know a lot of how it's affect on structures. Like lots of people, never mind, they just keep like already we see so much deviation on the ankle. It's going so much inside, or even it can be slashed out. And I was advising them, okay, guys, can you please get the orthopedic insoles, or even make checkup. There is lots of personalized checkups already regarding the feet, where they can, print it for you, the insole, which
So
can
they can, they can
cover
create,
is it too flat, or there's different type of arches, whatever. I think this is neglected issue, which people start to treat the back without treating this type of cause.
Because a lot of most of our members, that's why we covered this topic, because usually their what you call this, their concern is, oh, I have back pain, can you help me with this? Oh, this exercise causes me back pain. Oh, after the exercise it we always have the problems of concerns from all our members, like, oh, after the workout we did today I have back pain. Oh, after before working out I have back pain because I was in work and stuff, can you help me, for example? So that's why we are covering this topic. But usually a lot of our members still it's difficult to apply our it was difficult for you to be able to give the exercises right, and they still keep on complaining about their back pain.
Exactly. It's there is no one size fits all. It's very, very personal. Like there are still like couple of students. I like, for example, as for me, everybody is supposed to be able to do back extensions and other type of exercises. But there are students I don't like. There are students even not bending all the way down, because whatever I tried, whatever I applied, it was causing more trouble. So, like looking on the student reaction, looking on the lifestyle, and looking on the attention they're able to give me, instead of keep teaching them, all of these type of exercises. Like I do have students who, whenever they come down to the floor, they feel dizzy. So what mistake, as for me, I did previous time, I was trying to teach, we did lots of floor exercises, and they literally hate the training itself. And I didn't get so much success. So then I realized a little bit, study more, I understand that basically how I can strengthen the back without going down. I can strengthen the back in the standing positions. So I start to do those time, like different anti-rotation presses, strengthening the lats by pull downs and seated rows. And by this, at least I can cover the musculature around the back without bending, without because somebody has also hypertension, they cannot, put the head down. Different stories. So very individual. So that's why there is no. But there are people who can make anything. Just you literally put barbell on the back and do extensions or deadlifts and everything. Not everybody needs to do deadlifts for sure. Like not everyone. It will cause before, but again, before I thought it's like it's a must. Now I changed my mind. Like not everyone. Lots of people might feel even worse right after that. So not trying to put in this strategy. So examine the person, knowing why it's happening. Can I cover it with muscle, or maybe I cannot? So very individual.
A very individual approach depends on the type of person.
And always observing, studying how is it affecting.
There's no really general answer.
And people react differently on their things.
Yeah.
Sure.
Yeah.
They react, like in your, for example, projection, you should apply this type of exercise, this type of feedback you're supposed to get. But not always happening like that. Some minor cases, there is like, going not as per the plan.
Correct. So are there any alternative therapies or complementary approaches that have shown promise in managing back pain. Aside from training, like what else are there that would help relieve back pain?
I don't know what I need to answer to you. I think training is the main things. Like lots of people think that, for example, common misconception. People having back pain, what they say, it's good for you to swim.
Like,
but good for you to swim.
Exactly. Like, for example, okay, do acupuncture, like all of this, you know?
Yeah, so for me to finish, do swim, right?
Yeah.
Do you know that swimmers having the worst back pains?
Yeah.
Yeah. Why? Because they floating. There is no compression on the back. So, like they can swim, they can do a great job, but they suffer and they all slouchy. You're supposed to think why they need to be open shoulders and everything because they keep keep being in the water, utilize so much movement. But in fact, they're very slouchy guys, and they do have back pain. Know it from experience of my friends who've been swimmers. So about acupuncture, release, and everything, I respect everything. I believe it works. I believe it can help. But I'm trying to say it's release.
Release.
Release. So if we build
So it's
like
a
massage,
relief.
massage is release, relief. I agree. It will help you. It will help you. You get into trouble, it will help you. It will release you.
Relief, yeah.
But what if we will just think differently? We will build the structure around, and we'll keep building it, like supporting it, and we think about this as a resource, right? And we should not overuse this resource. We should make sure we maintain this resource, and you'll be fine. I'm talking about this on my own experience. As maybe I was telling, when I was 19, I injured my back so badly, so badly. Even though I was training, I did deadlift I said, okay, let me try, do deadlift, and don't brace my core like this, just on a relaxed core. And
Wow.
I had crazy snap in my back. Like it was, I
my
literally felt like my disc just, shifted.
I can't imagine.
Yeah, so I was 19 only, and then I was like, okay, I'm finished. So and then basically, I went to Masoro those time. They was trying to put me back, but it's just so I was not able to sit for a couple of days. Just standing, laying down only. And I went to the gym. I wanted to put bar on my back. Done. I cannot. I cannot even to put empty bar. So as soon as I put empty bar, there is like a
You feel like
it's like electric stream in my head, in my back.
Oh.
Okay, let's now talk. If I would be
how did you, manage that?
of course, I mean, based on look, why I'm so now in this case confident what I'm saying, because let's imagine if I would have all resources by those time, right? I would do MRI, everything. I would go through many doctors. They would advise me to to put some brackets on my back, whatever you
Yeah.
name it. But I didn't. I didn't have such resource, so I have to work around it. Yeah. So by those time, I don't know. I still believe my best cure it was hyperextension machine, the back extension, without weight, multiple times, then with light weight, extensions. It took me time. It took me time, almost a year, until I was able to put barbell on my back. But
you recovered.
yeah, I recovered. You can say, okay, but if we check X-ray and everything, your back is broken. I know. Their back is broken and only muscle are holding them, but it's fine. I hope all my life I'll be holding back with the musculature. That's why we have 2 GHD inside. We have back extension. We do.
You do a lot of back exercises.
I do hamstring a lot because also it helps to hold the back. Hip flexors. So this is my method. I respect everybody in the industry, but I believe we need to build resource. Resource will help you to alleviate pain over time and then not cause it. And not only that you know that you're armored with this type of things,
So there's no really a cure that can, remove back pain like totally. Not just relieve, but remove it 100%. There's no specific.
And it's
cure.
never come back.
Yeah.
But nothing happens like that in life. It's just an illusion.
Okay. Can you provide us some advice on maintaining a healthy back and preventing recurring episodes of pain?
Again, so for example, let's as for me.
Because okay, you as you know, you love training. You've been in fitness from 7 years of age, but to some people who has back pain, they don't have that mentality of training daily and making sure this they need to cover. Some of them they like. Is there any other
I agree.
ways
But you decide.
for them
Okay,
to?
again, let's put people with diseases aside, not our.
Yeah, yeah,
expertise.
not our.
If you find, you decide. You do a little bit abs, planks, extensions, like let's say even on the floor, Superman's holding this way as a daily routine, and keep going on. Or you say no. It's not like give me some. What you are trying to say now. Give me some way, but not to do that, right?
Yeah.
Tell me something, but not to do that. But I'm saying do a little bit, 15 minutes per day. Like as you see in every session of our training with any students, we do have core exercise
Yeah.
always,
Yeah.
regardless. It's leg raises, it's extensions, this, but it will be something. In every exercise, every time we train itself, definitely there is one exercise for core.
For core, yeah.
So it's a must, and I think like this has to be done daily.
Okay. Are like how does aging impact back health, and what steps can individuals take to mitigate age-related back issues, like probably from 30 onwards?
Obviously, our bodies slowly.
Especially, for example, okay, they are 30, they never done training, and they've been suffering for back pain, but relieving it through massage or everything else. So, is there any steps they can take?
Again, I'll put back everybody to our preaching. Like, okay, you after 30, let's say lifestyle, lots of people driving lots, like seated, hips are tight and everything. They obviously need to a little bit stretch here and there. The thing is, with a question regarding aging, you need to know that also, yeah, we'll keep losing muscle mass every year already, especially after 30, after 40, like close to 60, like especially if you are not maintaining muscle mass, which is those pillars which is holding you up. You grow the fat tissues, right? Which is completely different, and it doesn't have any structural component, and it's just extra item, which is just generate additional hormones, not good for you. So you need to be even more eager to sustain your muscle mass, to even add up. That's why the diet of contain at least the certain amount of protein should be there. So this type of things. So I believe I don't want to. Let's agree with this topic in this way. You better do it exercising. You better think how to maintain it, rather than you will end up the doctor advise you. Okay, now now you need to exercise. Look, for example, look what we see now with the guys who had real issues. They passed through operation. Okay, they did physio, right? And then what physio say? Okay, now you better do it 2 to 3 times in a week, right? We know it in our staff example and everything. They come, okay, so now you need to work it.
Yeah.
Did they come and a couple of times fix it? No, they say, okay, I'm coming to you 3 times. I guide you how to do it. I'm explaining you what you need to do. And now please, on your own, do it.
You have to work on it. Yeah.
So this awareness is coming like I don't think so we can bypass it. We can, but this is the method to cure. The thing is people don't do.
I remembered one time I think we were training together, and then we were doing some kettlebell exercises.
Yeah.
Yeah. I would love for the listeners to. I would love for you to share for our listeners, like what happened in those, like, because how many days you couldn't able to bend and even sitting was so difficult on that. Like it was, I think the worst moment I've seen you like
That
yeah
yeah, in that. So my mistake was there, as I say, about resource. So I'm much more wiser now in these cases. So those time I was also training every day for a long time. And when I was competing with you, I pick up the heaviest kettlebells because I have to pick up the heaviest kettlebells those time, right? So now I would not do that because why I need to do that? Why I need to pick up the heaviest kettlebells? My goal is just to train and enjoy. But those time I had the mentality that I need to lift heavy.
Beast.
So exactly
Beast mentality, need to show off.
yeah, it doesn't serve anyone except your ego. So yeah, I pick up those time heaviest kettlebells and we did double kettlebell snatch and we did burpees and snatch and that's where resource is overused because I didn't rest. I mean every day. And I also like train now every day.
How many sets was?
We did 10 sets. It was very intense. But it's not about this. The thing is I overused my resource by those time. Pick up more than I was ready for and didn't recover enough from previous session. And like that's the main reason. So, and I got severe spasm, right? I could not like even change the weight in the machine. Like, I had session next, I'm taking shower, like, there's no way to release it. It just complete spasm. I cannot sit straight. Yeah, you put me in the car on the side.
Yeah, and whenever he's entering the car, he's laying down.
Yeah, laying down because I cannot
sit.
Yeah, on the side like this. I was laying down on the side because as soon as I sit, my back start to squeeze me and again put it down. So yeah, it was very severe spasm. But I of course I tried some cream those time, but what I did was, I just lay down flat on the floor, and already from there I start to do a little bit dead bugs, a little bit laying down, a little bit twist. Definitely, the reality is, I injured myself already. I got it. Tomorrow I will not wake up fresh. So it took me 3 to 4, I think, to 5 days until gradually I recover. But of course, during the day I was moving my leg little aside, leg little back, small flexions, holdings, or even going through pain. But reality is, I already injured myself, so it will take at least 5 to 6 days. It seems like you get some, let's call it, you get some virus, right? Even though you start to recovering, but done, it will take 5 to 6 days. It will be with you 5 to 6 or 7 days usually. You will take medicine, you will not take medicine, you will take intense medicine, but it will take until the virus will disappear.
Yeah.
So same with back, it was taken 5, or this case, or another case I was doing also, as I was saying before in some video, that most of the injuries happening when you are not putting the concentration, like those time when I release my abs, Another day I did some, for example, windmill. Also, I was thinking about some of my own calculations, and also I completely snapped myself. So, but okay, I got it. I know that it will take 3 to 4 days, and I need to do now recovery work and everything. So that's things. Or it can happen in sports activities when not controlling yourself, quick sprints and everything.
Quick change of
that's why I'm
direction.
so much against when people just playing. They're not training. So, because this is like you go to play, you go to perform. You didn't prepare for that, like behind the scenes. There is so much potential to injure yourself.
I'll go play paddle today.
There is so much potential to injure yourself. So not fan of it. Until you build resource, go play. At least you know that there's structure which is holding you up. So that's what I was trying to say.
That's very true. Even we have one of our team here. We were dancing, and then through like very fast move, snap on the back. It is the same. It was the same, right? Like spasm on.
Of course it's spasm, but it was not enough. Like, anyway, let's call it resource. The best, easiest answer. It can be not enough flexibility, not enough mobility in the region, not enough strength in the region. That's why it's happened. Muscle didn't fire properly in the right time. New movement, just like for example, new movement, muscle didn't fire properly. I was like, okay.
Got it.
Yeah.
Yeah, you got it. And I would love for you to share the story of one of our team as well, who has like really serious back problem. Yeah, who couldn't bend, who couldn't twist even. share the story.
I think he's still with this pain. So
Yeah, exactly.
no,
So
the reality is, the guy has some very, like it's called, like basically bamboo back, right? So the back
bamboo spine.
Yeah, the back almost not flexing, but one of the cause was he was hit by a car. He didn't take proper recovery.
And he was laying down for a long
laying
time.
down for a long time as
Did
as
not
a
do anything,
one
yeah.
way of resting, right?
Resting, yes.
So you need to understand. So now muscle been injured, right? And what happened with muscle when they injured in some certain areas? They're not coming back as a muscle. They're coming back as a scar tissues, or they're coming back as a like. So, for example, you can imagine now muscle is like a meat, right?
Yeah.
And ligament is just a string of connective tissue. So when the muscle are inactive or didn't work, it's become not muscle anymore, which is contracting, right? It's become connective tissue. It's become just like it's not moving, it's not bending, right? I was reading recent research. If it's too deep enough, recovery was not done for so long, it's almost impossible to, redirect this process. So basically, it's supposed to be muscle going all around, but in fact, it's just like 30% of muscle. Other one is just like scar tissue, connective tissue.
Yeah.
That's why they're not bending. They just like.
There's no mobility in there.
Yeah, no mobility. That's why the movement's very strict. Maybe there is even no pain. Maybe at the moment because we know there is no pain.
Yeah, there's no pain.
Just the thing is, it's too rigid. Structure. How to help him? As you know, it's not already in our power.
Yeah.
But definitely movement. What else? Okay, you don't move. What else you can do? Like how many students was coming to us like, if other people would be on my place, they would not come. Okay, don't come. Like, you know what I mean? What you just have to do that. This is the reality.
Because they're afraid of, when they did exercise, they kind of have the anxiety that, okay, if I do this, it will cause more back pain. So they have that in their head, That's why they said, no, I don't want to do this. I'm sure it will not help me. So they're so defensive on it because they're afraid that if they do it, it'll trigger more.
Exactly. Depends. I'm very careful in these ways now.
Yeah.
Before I was trying to break everybody and say, yes, you have to do that. I'm very careful now. So if there is very strong mental blockage, then okay, I'll step back. It will not, because the person, if already set up that it will cause pain, it will cause pain.
True.
It will cause, because person already say, okay, it will happen.
Then it will
You know how mind is powerful in terms of prediction and all of these manifestations. So it will happen.
Correct. Whatever you say will happen. Correct.
Vice versa. There are people who are very strong. They can put themselves from deep hole when they're strong mentally.
That's true. So I think we covered a lot of things. And just what are some key takeaways and tips you would like to share to our listeners?
Yeah. So guys,
to remember, how to manage back pain.
Take away from our conversation. Yes, I know it was rumble back and forth about actually the same topic. Yes, if you have medical conditions, okay, let's try to search for the best doctor who can advise you. Ideally, non-invasive means without operation. If there is any way to recover it without operation, because as long as you enter the spinal canal and you put the cords and everything, you restrict your mobility, you restrict the future motions, and you'll be always very aware of that. That's one thing. If there is any chance to recover it with physio work, I know it will take longer. Like, for example, the good stuff, when you put through operation, pain is going away, right? But you're not, you didn't fix the issue. You fix the pain. There's no. So yes, you'll go for longer time over the pain. I mean, again, if there is a chance to do it through physical exercises, you'll be needing to strengthen way more muscle than before, yeah? Because you need to build up, let's say you need to rebuild yourself literally. Mm-hmm. It can take a year or 2 years, and it's like, the main thing is no fail. approach. Like you need to religiously take care of yourself. But there is so many life examples when the best athletes and everything. They was since they're super strong mentally, they was taking themselves from so severe things like severe injuries. So and try to understand if you consider yourself and those areas as resource which we need to first build brick by brick, like strengthening all around from the core, lower back, obliques, the back musculature and the lower back, QLs, hips. Like there is all muscle which is holding this box in the center. You can have much better quality of life, I believe.
Correct.
So think whatever whatever matters more. I'm here not to give you fake promises saying that this will help you, this will help you. I'm saying this long road, dedicated these exercises, little bit boring, little bit not sexy, but it will be with you. Like you will know that you are the one who recover this,
Correct.
and give you confidence. And if it will happen again, like you will snap this, okay, got it. I'll go through series of stuff.
Yeah, just go through it.
Even the best.
Take the
Exactly.
take recovery seriously. Don't be like, no, recovery is shit. Don't go right away to shortcuts, like go doctor right away, all these. Just take your time, even if it takes you 5 days, 10 days or more. Take it one step.
Compounding.
Yeah,
Compounding.
exactly. Because at least you can function longer, like Greg right here, who has serious back pain. And even for me as well, I do have back pains sometimes, but really training really helps. Like it helps you a lot. There's no need to complicate so much things. Easy answer, easy takeaway from me, from my perspective, is just to train. That's it. Yeah, we're done.
Thank you very much. Thank you for listening, guys.
Yeah.
We have good experience in strengthening the abdominal part, the core, and the different musculature around the painful areas. Please visit us at You Skilled Home. Ask us questions. We will try our best through exercises to help you.
I hope that we cover this topic really well, and I hope you got some insights. And I think we're done.
Thank you.
So thank you so much for listening to our third episode of podcast, and I would like to thank Greg as well to that you shared your expertise regarding this. And I hope that you will reach us out on our social media accounts or even email us. So if you have any more questions regarding back pain, we would love to answer that. Don't forget to subscribe to You Skilled Home Podcast to stay updated on our future episodes, where we'll continue to explore various aspects of health and wellness. We appreciate your support and your presence in our growing community. So thank you for tuning in, and we'll see you next week.
Next week. See you guys.
See you guys.
Who is all fired up? Y'all better just